The knee joint is composed of the articulation of the condyles of the femur, medial and lateral condyles of the femur, with the medial and lateral superior articulating facets of the tibia. The patella, or kneecap, is important for protection of the knee joint and providing a lever for the quadricep muscles to work on, but it is actually not part of the knee joint itself. The fibula likewise articulates with the tibia distally to the knee joint and is not actually a part of the knee joint. So as you can see from this image, there's not a whole lot of bony restrictions on the knee joint. If it were just the bones and no other ligaments or tendons holding this in place, it would have pretty much unlimited rotation either way, adduction, abduction, and flexion and extension. So it would have really great flexibility, but really, really bad stability, and would get injured even more often than it does anyway. And there are three major pairs of ligaments in each knee. So 6 ligaments total, 3 pairs. The medial and lateral collateral ligaments restrict pretty much any possible abduction or adduction of the knee joint, and they restrict any rotation so long as the knee is in an extended position. When the knee is flexed, these collateral ligaments are in a slightly looser position, and they can permit a little bit of rotation of the knee joint. So when the knee is flexed, there still could be a little bit of rotation possible. The anterior and posterior cruciate ligaments, also known as the ACL and PCL, basically run through the middle of the knee joint and form a cross, hence the cruciate. So if you've ever heard of someone tearing their ACL or their PCL, this is the ligament they're talking about. The ACL runs from the anterior surface of the tibia to the posterior of the femur, and the PCL runs from the posterior surface of the tibia to the anterior of the femur, and they run through the intercondylar notch. The book does have some better images so you can see exactly how these cruciate ligaments fit in the knee. And this pair of ligaments are the primary restrictors of the knee joint sliding anteriorly and posteriorly. So these are what keep the knee from sliding back and forth, forward and backward. And they also help restrict rotation when the knee is in a flexed position. The popliteal ligaments are on the back side of the knee and are the primary restrictors of hyperextension. If these ligaments are loose, whether that's due to overstretching or just naturally loose, then you can have hyperextension of the knee, which in dance, as we know, is sometimes looked at as a really good thing, and it's usually because of looseness in these ligaments here. And having that hyperextension gives you that nice line that's desirable in a lot of forms of dance, but also gives your knee less stability and has an increased chance of injury.